Welcome, doctors. Let me ask you something. When you hear the term virtual assistant, what's the first thing that comes to mind? A scheduling tool? An AI chatbot? Maybe someone answering phones remotely? In healthcare, it's something much bigger. There's a group of professionals, virtual medical assistants, or VMAs, who are carrying the weight of our clinics every single day. And most of the time, they don't get seen. They don't get thanked. But without them, we'd be drowning in documentation. They're the ones handling prior auths, updating EMRs, managing patient follow-ups, verifying insurance, all the things that take hours but get none of the spotlight. I had someone tell me once, doctors think the charting ends when they leave the room. For us, that's when it really begins. That stuck with me because here's the truth. The efficiency crisis in healthcare isn't just in the exam room. VMAs are juggling so much: real-time charting, incoming messages, referrals, EMR compliance, and endless follow-ups. And the workload? It doesn't stop when the clinic closes. One VMA said, "I stay online for hours after the last patient leaves, just to finish notes." Burnout doesn't always look like someone falling apart. Sometimes it looks like backlogs. Sloppy notes. Mistakes that shouldn't happen, but do. And that brings us to the cost. Not just the emotional cost for the VMA, but the ripple effect on everyone around them. Incomplete documentation delays billing. Late prior auths hold up treatment. Missed follow-ups frustrate patients. And when the VA falls behind, guess who stays late? You do. This isn't a minor problem. It hits your time, your patients, and your revenue. And the worst part? Most clinics don't even realize it's happening. We don't talk about VMA burnout because their work happens behind the scenes. They're support. They're invisible. They're fine until they're not. By the time errors pile up or someone quits, it's too late. You're already retraining, reassigning tasks, trying to clean up the mess, and paying for it in both time and money. Let me say this clearly: replacing VMAs is expensive. Way more expensive than building the right support systems from the start. One provider told me, when one of our VMAs left, it felt like a leg got pulled out from under the table. And that's exactly what it is. These aren't nice-to-have team members. They're critical. So how do we fix this? Let's start with balance. One person shouldn't be responsible for every chart, every message, every auth. Outsourcing overflow to a trusted partner like Staffingly, Inc. can keep workloads manageable and accuracy high. Then there's technology. Look, we all know EMRs can be clunky. But with the right tools, speech-to-text, AI-powered scribing, smart automations, you can take hours off someone's plate. And most importantly, recognize your VMAs. They're not just admin support, they're part of the care team. A fair workload, real breaks, and a little acknowledgement go a long way. One VMA said, "When the doctors value our work, even the long days feel worth it." That's what it's about. When you support your VMAs, they support you. And your patients feel the difference. So, here's the bottom line. VMA burnout isn't a personal failure. It's a systems failure. If you ignore it, you're going to pay, in delayed care, frustrated providers, and lost revenue. But if you invest in your VMAs, give them real support, and use smart outsourcing strategies, you'll get better documentation, stronger compliance, and a care team that actually works as a team. Doctors, we don't have to accept burnout as part of the job. Not for us, and not for them. Let's fix the system, not just the symptoms. And if you need a partner to help make that happen, Staffingly, Inc. is ready when you are. Thanks for watching, and more importantly, thanks for caring about the people behind the screen.